Hi everybody, Dr. Susan here, and today I wanted to talk about something that is really important because a lot of people have this idea that in weight management and weight loss, the only things to consider are calories coming into the body and calories going out of the body. Now, obviously, activity is always very important, right? Nobody wants to be living a stagnant lifestyle. We want our bodies to move. Of course, exercise has many health benefits and is super important. But just looking at the caloric intake and then the caloric expenditure is not really the most efficient way to manage weight and have weight loss, right? Because there's many factors that are involved. So one of the factors that's very important in this is what's known as metabolic variability. Well, what does that mean? It means that every person is different in how they metabolize foods that come into the body, right? So just like not all calories are equal, right? Like you could have a cup of broccoli versus a cup of M&Ms. Well, our bodies don't utilize those two things in the same form and fashion. Well, similarly, right, we have lots of different influences into how our body is metabolizing the food and the calories that we're intaking, and it's never the same for two people. It's always going to be different because we're all different. So some of the factors can be genetics, they can be hormonal influences, it can be age, it can be gender, and of course many other variables, right? So that means that we could have two people consuming the same foods and having the same activity level and have totally different outcomes, right? So therefore, we can't use that as a basis for the weight management or weight loss. And that's why what we do in functional medicine is so important, because what we're doing is we're getting into the deeper reasons in the body, right? What's the physiology for that specific individual that is driving their body to do what it does with its foods? It includes a lot of information that we delve in deeply with that individual, as well as some laboratory testing that are not necessarily the conventional tests, so that we can really get a proper body profile and really better understand exactly what's going on with that individual. I would love so much for you to reach out to me so that we can talk to you about what your needs are and exactly how we might be able to assist you in helping handle whatever it is that you're challenged with.